Hi, my name is Dr. Alexander Fraser. I'm a consultant rheumatologist in University Hospital Limerick, and I've been asked to speak about just some ideas about pain and how we perceive it amongst our patients and the people we deal with in clinic. As rheumatologists, we deal with many different disorders, but arthritis and joint pain would be one of the major ones. Um, One thing we find is that pain is an incredibly subjective, personal problem. People who don't have the pain often find it very difficult to understand what an individual or a person or a patient or a relative is going through, because clearly they don't experience that pain themselves. Now, I haven't experienced my patient's pain either, but after many years of sitting in clinic talking to people, I think you develop an empathy or an understanding of what it must be like. And chronic pain, chronic severe pain, is just the most dreadful thing for people to deal with, whether it's a chronic back problem, a chronic joint problem, an inflammatory problem like ankylosing spondylitis. The combination of being constantly in agony, I think lack of sleep is a huge issue. People have pain, they've obviously during the day, but on top of that they can't sleep properly because of pain. And all these things add up to an incredibly disabling circle of events, which I have great empathy for people with it. There's no doubt in my mind people with chronic pain end up with or have a degree of psychological stress, which can often extend into depression as a result of having these problems. And I always think that the two go hand in hand. If I had chronic pain, like many of my patients, couldn't sleep, was disabled, I think it's entirely natural that nearly everybody, or even everybody, will develop a degree of this. And that's an element that people often don't want to discuss because of the let's say the defenses between us and our concept of depression and psychiatric disease, which I think we are breaking down at the moment, but we need to continue to break them down, because you have to discuss the element of anxiety and depression in relation to chronic pain, because it's part of the solution. The other element that struck me when I was asked to speak about this was the concept of tablets and painkillers, and what we euphemistically call painkillers. And I often say to my patients that they're totally misnamed, because they don't kill pain. To kill pain is to get rid of it. Tablets and analgesics generally have a role to play in many types of pain, not all pain. They can be highly effective, they can be moderately effective, they can be not effective at all, but they don't kill pain. They have to be used in the proper environments to try and improve pain. So if you get a 20, 30, 50% improvement, that's great. But the concept that I think we're sold, that they're painkillers, and if you use enough of them in the right way, nobody will have pain, is entirely wrong. And the problem with that is that the constant push to increase tablet doses, whether it be analgesics or even opiates, to the point that there is no pain, is often causes problems, where patients end up on far too much medication, which actually causes problems rather than solves problems. As I say, the only guaranteed form of analgesic or medical pain relief is an anesthetic, which obviously means the patient's asleep, so it's not really a therapeutic option. The last thing I suppose touches on what I spoke about before, which is many people that we deal with chronic severe pain look normal. They don't have a cast on their leg or a bandage around their head. They're not in a hospital bed, so their relatives and friends and people who deal with them can find it very difficult to comprehend the agony they're going through. If you have a young man with severe ankylosing spondylitis, inflammation of the spine, their life can be a living hell. They can often get up at 5 a.m. to stand in the shower for 2 to 3 hours so that they're loose enough to get their clothes on to be able to get to work by 9:30 or 10. And that's a constant thing all day. And yet they look from the outside entirely normal, or well even. So from the patient's perspective, it's even more isolating than what I spoke about before. And I think it's important for people who live with and work with people with chronic pain to understand that people can have a living hell without looking as like the typical um, battle victim with wounds and bandages. Thank you.